Full also. Yes.
ना कॉल
Good morning, all of you. We'll start our webinar within 1 or 2 minutes. Is there some technical error to sharing the screen? We will just start in within 2 minutes. Kindly wait. Good morning, all of you. Today we are gathered here on the on webinar on role of physiotherapy, a role of sport physiotherapy in making champion in sports. We have with us Dr. Meenu Dhingra. She is a ex senior scientific officer in JNS Stadium, Sai. So welcome you, ma'am. We
Thank
have with
you.
us Dr. Nidhi Kalra, our officiating in charge, and all the faculties of BCIP. Today webinar will be hosted by Sports Club, and I'm requesting you, Nidhi ma'am, kindly please say a few words to ma'am.
Thank you, Dr. Asif. A very good morning to everybody present here, and a very, very warm welcome to our guest speaker today, Meenu ma'am. Thank you so much. You have been always with us. We had the pleasure of you hosting you at our conference also, and today as well. Thank you so much for all the support that you always lend to us, ma'am. And it is always a great experience to learn from your experiences, from your knowledge. Thank you so much, ma'am, for accepting. And on the behalf of whole BCI family, I again extend my warm welcome to you. I hope all the students and delegates present in this webinar are safe and healthy. And thank you so much, ma'am, for accepting our invitation. Thank you so much, ma'am. It's a pleasure organizing. Over to you. Thank you, ma'am.
Thank you. Good morning, everyone. Am I audible?
Yes, ma'am. Ma'am, just for a minute, we want to invite you as a formal invitation. Right?
Okay, sorry for
Over
that.
to you, Zainab. Kindly proceed.
Yeah.
Zainab, kindly unmute yourself.
Okay, so
Please
good
proceed.
morning, everyone. Myself, a final year student of Banarsi Das Chandiwala Institute of Physiotherapy. On behalf of BCIP, I would like to welcome you all today for our webinar on role of sports physiotherapists in making champions in sports. And to enlighten us on this topic, we have with us Dr. Meenu Dhingra. She is a sports scientist who has worked with the government of India for over 3 decades. She has completed her PhD in anthropology from Delhi University. While working at the Sports Authority of India, her role has been crucial in Mission Olympic Cell, which is
Hello.
responsible for preparing athletes for Olympic, Commonwealth, and Asian Games. Dr. Dhingra has also pioneered the age verification program for Khelo India, which provided an efficient system for identification of the right athlete for the right sports at the right time. She is also a published author of 2 books and numerous articles in numerous international journals, including the British Journals of Sports Medicine. She has the experience of working with several national and international sports scientists across the globe. Now, I would like Dr. Dhingra to take over the session and enlighten us.
Thank you, Zainab.
Thank you so much, ma'am.
Uh, I'm just testing my audio video. Am I audible enough?
Yes, ma'am.
And my screen, everyone can see it?
Yes, ma'am.
Yes, ma'am.
Okay. Thank you very much. A very good morning to all the senior faculty and all my young students. It gives me great pleasure to address the young students as always. And it feels really, I'm grateful to the young people who are aspiring to become physiotherapist or chose to become sports physiotherapist. So, as always, a great thanks to the Institute for welcoming me here as a faculty for webinar. I thank personally Asif, Nidhi Kalra, Zainab for all the pains you have taken to make this, live. So before I begin, I just would like to say a brief introduction about, what all we do in the Sports Authority of India. Since you all are young students who I presume would like to become sports physiotherapist or would like to take training to be associated with the players, so I would like to share my experiences having worked with Sports Authority of India for almost 30 years. So in the last few years, I was heading the medical center and the physiotherapy center along with my sports sciences division, wherein we have worked very closely with all the national athletes, international players, coaches, medical staff, and of course the physiotherapist. So this presentation will basically give you a glimpse of what a physiotherapist at Sports Authority of India is supposed to do. What is his main role in bringing, quality performance, great performance in the field. Okay, so the topic of today's seminar is role of sports physiotherapist in making champions in Indian sports. Now, as you all know, that there has been a great, boom in the media. Media is playing a very great role, and because of this online streaming, the popularity of sports as compared to other events has also zoomed. It has become very, very popular. You remember in earlier days, we used to mostly watch cricket and football or maybe tennis. But in the coming days, I've seen in the last few years, media has played a very active role in other sports as well. For example, if I talk about hockey, about boxing, wrestling, now I'm sure everyone hears of, such competitions happening in our country. So when the media plays a very important role, especially Star Sports, which is giving a live um, recording of the competitions in other sports, everybody's attention becomes now on sports. So there is a boom in the economy. That's very good. At the same time, it has made our competition very, very tough because everybody's stakes are very high. When the stakes are very high, there is a undue pressure. The sports become very demanding. It's demanding for the player, it is demanding for the entire medical team, it is demanding for the entire ecosystem. So when there is such a demand, in such a case, the player goes out of bound. He tries to perform beyond his limits. And when he does that, what happens? It's bound to have injury. So this is where our role becomes very important as sports scientists, as sports physicians, or as sports physiotherapists. When the player becomes the center of focus in a competition, when he is performing beyond his, permitted limits, and when injuries happen, how we have to sort out all this is the focus of today's webinar. Now, as we all understand, these injuries are not easy to handle. अगर एक बार इंजरी हो जाए प्लेयर की तो it becomes a very painful task for not only the player but for the entire team. In that case, the role of physiotherapist and the doctor is not only to relieve the pain, to relieve the uncomfort of the player, but also to recover, to rehabilitate the player in the right way so that he's back to the competition, he's back to the games. And not only back, he gives his best performance over there. So, when such a thing happens, first of all, we have to make all efforts to avoid injuries. And if suppose, God forbid, if there is an injury, how we can make the athlete rehabilitate and get back to the field at the earliest time possible. Because here, not only the career of an athlete is involved, it is the career progression of the coach, it is the career of the country, is the winning a medal in the international competition. Everything is at stake. So now let us understand what will be the role of physiotherapist in Sports Authority of India. Apart from the very, as part of their qualification, they are supposed to provide treatment and rehabilitation from the injuries. And they are also to provide support through injury prevention, maintenance, and recovery interventions. Now, as of now, earlier it was one physiotherapist taking care of all the players. Now, you see, I have players in my center who are coming from different games. Not only different games, they are from different age groups. They have different physical fitness status. So it becomes very challenging for a physiotherapist, first of all, to understand so many games. What are the challenges or the demands of that game in the field? And then accordingly, he has to understand ki what is the musculoskeletal injuries that could be possible because of this particular physical activity. So now we are trying to sort of graduate from that and become like sports specific physiotherapist. Now, more often than not, we have physiotherapists who will be taking care of at least two or three games which are more or less similar, where the physical demands are also similar. For example, if I say football or hockey, these are team sports. When I say about contact sports, okay, we have boxing, we have wrestling. So, more often than not, the physiotherapist not only have to understand these games, but also will become very proficient, will become very expert in dealing with injuries in these games. Now, not only that, he also has to, in development athletes, he has to promote the participation of safe physical activities across different age groups and different physical fitness. Now, what I've seen in my medical center is that whenever there is a training happening, the younger one will try to imitate the older one, okay, without realizing his basic physical fitness status. So, since there is no such supervision by a coach, sorry to say that the things are still, we are not so very well organized. The young children, the young player are still playing games by just observing how the senior athlete is doing that. So when this thing happens in the field, then there are bound to have injuries. And in such a scenario, then the physiotherapist has to, you know, not only provide him the right guidance, but also will have to see how best he can recover from this injury, and also to make his training program so that he develops without any injury. A typical setup at Sports Authority of India Medical Center is divided into three parts. One is the clinic based, like we have a physiotherapy clinics in a regional center across the country, wherein we have the physiotherapist posted. They could be male and female physiotherapist, which is well equipped with the equipment, rehab equipment, and some high technology equipments. Then there is a field based physiotherapy treatment which we provide, wherein the physiotherapist has to see the training sessions, how the player is playing every day in the morning session, in the evening session, and also give the physiotherapy treatment during the competitions. And the other third part, which we are still not so well, uh, what shall I say, organized yet, but still we have made a start, is the research. So many of our physiotherapists are now involved in making our own research, our own guidelines, our own protocols, which are apt for the sport, which are apt for the physical fitness status, and which is also apt for the young athletes across different age groups. Now, here in physiotherapy center, I've seen that most of my physios have their more main focus on the manual therapy. Of course, it's a very good intervention, a therapeutic intervention to deal with the sports injuries, because this is the best way one can relieve the patient with pain and also having all type of musculoskeletal disorders. So this type of manual therapy helps in improving the range of motion, or they will induce relaxation, or they also help in manipulating the soft tissues, and also, reducing the swelling. Now, what I've seen here is that once a student will graduate from his degree, not much, maybe it will be an individual liking for the physio that he would like to learn more and more on the manual therapy part. But often I have seen that not many people have that kind of acumen to deal with the manual therapy. So it so happens like if you're not able to palpate the right tissue, if you're not able to understand the, mechanics, biomechanics of that joint, then I'm sure the treatment will not be so good. In some cases, there could be contraindication also. So in such a scenario at SAI, I was trying my level best to get the best faculty, which often I hear is, good people from, different states. Like from Orissa, I've seen that people generally talk about, he's the expert in India for manual therapy. So we try to organize those type of workshops, those type of seminars where more and more our Sai physiotherapists get, trained on those manual therapy. So this only not only refreshes your, skill, but it also gives you the latest which is happened, because the more experienced hands you have, the better you will give your best to the athlete. So this is what my main thrust would be, to all the physiotherapists, young and old, that you must have a good skill on this manual therapy part, because in sports, manual therapy almost takes about 70 to 80% of the treatment part. So, not to say that equipment do not play an important role. We also have good high technology equipment in our centers. We have high power lasers, and here our physiotherapists are, giving treatment for various type of problems like painful shoulder or trigger points, knee arthritis, and so on. So this is not so often used, of course, for the elite players wherever the problem becomes so acute that is not possible by another other electrotherapy. Then high power laser is also being used. Now the another equipment which we have seen here in Sai, which is making a big, impact on the performance and relieving pain of the athlete, is shockwave therapy. So even I had been a patient with my trigger points, and I've realized that this is a very good equipment which gives instant relief, in one or two sittings. And all those athletes who have, disorders of tendon insertions, or they have, some lymphatic congestion, these shockwave therapies have really been a great boon for, relieving that pain. Then we also have recently we have also procured hot magner, and initially we used to depend mostly on the short wave diathermy and the long wave diathermy. Then there was a school of thought that this is not a good therapy. It has many contraindications. So based on the latest inputs from the best technical people, we have also procured hot magnet to give, best treatment to our player. We also have ultrasound therapy. Of course, this is the first line of treatment. Most physiotherapies are well used to providing treatment through ultrasound and also through combination therapy. Then we also have ice making machine to treat all type of acute injuries, acute swelling, all type of soft injuries, myofascial trigger points. So this ice making machine is the first line of treatment, wherein most players are generally crowd about near the medical center and the physiotherapy centers. Then also, I have seen that TheraBand station. I had been visiting, centers abroad. I have seen that uh, not only manual therapy, the TheraBand stations also are very popular abroad as well. So I think we should also encourage more and more our physiotherapists to give treatment and performance. What shall I say? Improvement of their uh, physical parameters to on the basis of TheraBand stations. So these TheraBand stations, they will help in, improving the muscle tone and improving the range of motion, and it will also improve the strength of the various muscles. So, as more and more people are now getting used to the TheraBand station, this also should be your best line of treatment for most of the physiotherapists who are listening to me now. And also, we have also procured the anti-gravity treadmill. This is, well, it was procured some 4 5 years back, and this treadmill is based on NASA technology, wherein there is a effect of the buoyancy. You feel the weightlessness here, and based on your guidance from the physiologist or the physiotherapist, you can reduce your body weight to as less as 20%. Suppose you are 100 kgs, and on this treadmill, if you reduce your weight to up to 80%, so you will feel yourself that your weight is just 20 kg, and you feel a very buoyant effect here. And with this buoyant effect, then there is not much stress on your joints which are injured. So this is a very good equipment which helps in rehabilitation of the athletes. And I've seen most of our hockey players and football players who often get injuries of the lower extremity. This anti-gravity treadmill has been a great boon to such players, and it is also popular with many of our staff who have the weight problem, because once you be in this treadmill, you feel that feel very light, and the kind of effect it gives you, because as an obese person you wouldn't like to run, and because it gives so much pressure to your knees and to your ankle. So once you are on this treadmill, you feel very light, and when you feel light, then you do more and more of physical activity. So with that kind of physical activity, you feel very motivated to do exercise, which otherwise you won't have done. So in foreign countries, this anti-gravity treadmill is become a very popular in all those weight reducing clinics. So however, here in Sai, we are using this anti-gravity treadmill for basically for lower extremity injuries. And quite a few of our physiotherapists who were doing their MPT have also done short study on physiological parameters, ki how the VO2 max could be improved by using anti-gravity treadmill as a training treadmill. So it's a great opportunity for you all to associate, with the Sports Authority of India and get a hang of all these high technology equipment and basically anti-gravity treadmill. Now, we also have for our elite athletes, for example, hockey players and some of our boxers, which are called the game ready equipment. These are just, attachments for different body parts, wherein you have the dual effect of compression and hot and cold. So this is a very handy equipment, and it's more popular with the individual athletes. They buy their own set, and this becomes a very easy for them to not only rehabilitate but also helps in recovery, after a very intense training program. And you don't have a measure or you don't have any equipment, so right in the comfort of your own room, you can just put on these and get relief from all the overstrained and over exercised body part. So now I have seen that there are many Indian companies also who are making this wraps, and these are also as good as the game ready wraps. Then we also have Cryo 6. I'm introducing you to all these technology equipment so that you understand that they play a very important role in not only rehabilitation from the chronic problems but also in the acute injuries, because the challenge here in sports is that not only you have to rehabilitate in a very scientific manner and in the minimum possible way, because athlete's career is very short, because he is here only for 8 to 10 years to perform, and this 8 to 10 years is a very critical period for him, which gives him, lot of challenges, where he has to succeed in his career and also has to avoid different types of injuries. So prevention is one, and then treatment from, if at all there is injury, to as fast as possible. So we have this cryo 6 equipment also. This also gives a, a wave of the cold air which goes as low as minus 30 degrees centigrades. And I've seen many players are getting good, relief from this, especially in gymnastics, and I've seen in certain players of boxing, this cryo 6 is very popular. Now we are also in the process of buying the cryo chambers. I've seen abroad also that these cryo chambers are becoming so popular that it becomes a very good recovery. Other than rehabilitation, they take it as a recovery mode also. So whenever there is an intense session, then after the intense session is over, they just take a cold chamber for less than a minute or something, and there the temperature goes to as less as minus 180 and minus 140 degrees centigrade. So this is becoming very popular there abroad, and there are many research findings there which says that this cryotherapy treatment helps in, improving the physiological parameters also. It helps in building up, removing the metabolic waste whenever there is an intense competition or intense training there. So apart from the clinic based, then what are the duties of a physiotherapist during the match session and during the competition is also very challenging again. So here a physiotherapist is a very important member of the entire medical team. So there, a team will have a chief coach, will have a support staff like a nutritionist or a psychologist. There could be a masseur, there could be a nursing staff, and another challenging thing is that, there is an assistant coach. So physiotherapist becomes a very important person here again in the entire team, and then his role becomes very important along with the doctor. So before there is any competition or any match happening, he has to make all the possible arrangements to provide first aid. He has to get, tie up with all the hospitals to deal with all the medical emergencies if so arises. So that helps, a player. Not only that, the physiotherapist becomes, only those physiotherapists who have involved themselves in the training camp are only possible to get deputed during the match session. So earlier in Sai, I had seen that, there could be a physiotherapist who is providing all the support during the training camp, and whenever there is a competition, whether it is India or abroad, some other physiotherapist goes and becomes a part of the team. However, now the scene has changed, and now more often than not, whether it is Ministry of Youth Affairs and Sports, or it is IOA, or the various sports federations, they are giving a chance to go with the player in competition only if he has been a part of the training camp also. So that's an advantage both to the player as well as to a physiotherapist, because physiotherapist knows the player right from the time he has been, training for at least 1 or 2 months. So he has seen him playing in the game situation, in the training situation. He knows his weaknesses, he knows his strengths. So providing treatment during the match becomes very, very easy and technical and practical also. So here the challenge here for the physiotherapist is, first of all, to prevent injuries, so he must have a very good assessment on his physical fitness parameters, And not only that, since you all understand that the player will go overboard here in the competition, he will bound to go beyond his limits. So the role of a doctor and a physiotherapist becomes very important here to educate the player कि ये आपके साथ इतना आपको करना है, your this is your strength, and this is how you have to avoid such an certain tricky situations. So that is one. And then the physiotherapist and a doctor also becomes a very important part of the training program, wherein the chief coach and the assistant coaches are involved. Here our nutritionist also plays a very important role. So, physiotherapist becomes a party to all this. He's part and parcel of the entire training program, which is being customized for every athlete. Now, there is not one training program which goes across to all the team members. Every player is customized based on his fitness and based on his physical activity demands. So, the individualized training program along with the physiotherapist prevention techniques helps a great in the match situations. So of course medical emergencies may arise. Physiotherapists and the medical team are well equipped for that, and here they have to provide instant relief instant relief from the pain. And here he has to do everything, whether uh, sometimes it is a what shall I say, a exam of the physiotherapist here, कि आपने उसकी पेन भी रिलीफ करना है, उसको दोबारा गेम में ग्राउंड में भेजना है. So here I've seen a physiotherapist are using cryotherapy, they are using taping, and they are also using this hot and cold packs. And in some cases I've seen some physios also doing needling also. So again, very important part of the physiotherapist to get used to dealing with all the medical emergencies. And the most important thing is also relaxation. So what happens whenever the match is over, the training is over, you cannot leave the player just like that. You have to provide them the recovery from his mm, intense competition. You have to provide him relaxation. You have to become his mm, guide, philosopher, and friend. You have to give them all the massage and everything. So all these are roles and responsibilities of a physiotherapist. And whenever a physiotherapist is outside India, then the challenges become more. So not only that, you have to get accustomed to the a new country with new language and new culture, but also get accustomed to the medical team over there, so that instant relief is provided to the player. Now, another important task I have seen here in physiotherapy department is more and more of our physiotherapists are now involved in the age verification process during Khelo India competitions. We were there in Pune, Khelo India competitions. We were there in Guwahati also, and recently in Bhubaneswar also. I've seen, along with the age verification cell, wherein our other young professionals are involved. Physiotherapists have taken a lead role here in the age verification protocol. Now, just to give you a background, since perhaps some of you may join as a sports physiotherapist, so you should also know what goes behind age fraud and what is age fudging in the different games. So, age fraud is something like when a player is, participating in a competition and taking an advantage being overage. Okay, so that means he's doing a fraud of his age. He is older, but he's saying his age as younger age and participating in a competition which is of younger age group. So we have to prevent all this. And in many contexts, this is also termed as age doping, just like, doping. And this has become a menace now. Now we all understand all the youth competitions are now age classified. And there was now competitions are held from as low as under 13 to as much as under 21. So in different sports we have different age categories. Like in football there will be a different age categories in the youth competitions: under 13, under 15, under 16, under 18, to as much as under 21. So this in August 2010, it was the first time that International Olympic Committee conducted the first Youth Olympic Games, wherein 14 to 18-year-old athletes were involved. So as you all must be already knowing that Khelo India competitions are mostly competitions where our youth youth competitions are being held. So we have competitions right from 13 years onwards, and it becomes challenging for the age verification cell to find out the correct age of the player, so that only the people who are with that right age should be able to participate in that competition. So basically, these competitions are held based on your documents. The documents are, your proof of the age. Now, we have seen that more often than not, people are fudging about these documents. So there had been evidences where the players carry documents that are deliberately classified, falsified. So in this, sorry to say that sometimes the officials are also involved in, fudging the documents. So we have seen that the most of the players will have their birthdays in the same month of the year. जैसे कि जनवरी में ही सबके बर्थडे हो जाएंगे या जुलाई में सबके बर्थडेज हो जाएंगे. So, and in some cases I've seen that players will carry two sets of documents, कि उसके पास दो दो तीन तीन तरह के 10th की सर्टिफिकेट है, उसके पास दो तीन तरह का पासपोर्ट है. सो ऑल दीज आर फॉल्सिफिकेशन ऑफ डॉक्यूमेंट्स. सो ये पॉसिबल है हमारी कंट्री में, ये पॉसिबल है हमारे रजिस्ट्रेशन ऑफ बर्थ एंड डेथ की, जहाँ पे ये फॉल्सिफिकेशन ऑफ डॉक्यूमेंट्स हो रहे हैं. चाहे इसमें ऑफिस इन्वॉल्व हो रहा है, चाहे ये कोच इन्वॉल्व हो रहा है, फेडरेशन इन्वॉल्व, ये प्लेयर प्लेयर ये इट्स अ गैमेट ऑफ fraud. So it has been a very challenging task for Khelo India cell to how to have these age thing rectified. So जहाँ पे भी deliberate होता है, there are some kind of penalties also now being imposed, and more often than not that that player is made to depart from that youth competitions if once caught with the deliberate age falsification. So why it is prevalent here is that there are a lot of loopholes. As I said that one is that there are birth certificates which are possible, and earlier we used to check our birth certificates if the certificate is within 2 years of the date of birth. Suppose he carries a birth certificate and his date of birth is, let's suppose, 1975, and the certificate says issued in 1975 or 1976. This birth certificate is fine. But however, if this date of birth is 1975 and the birth certificate is issued in 1985 or 1990, so then there is a eyebrows are raised. That means there is some kind of problem in this certificate. So such kind of certificates we check with great caution. So not necessarily that everything is fraud. There could be instances where the player must have been born in a village and there may not have been a proper documentation of his birth certificate. But 80-90% of the problem is there, that this document is not correct document. एक ये प्रॉब्लम होता है. दूसरा प्रॉब्लम ये भी होता है कि जो कंपटीशन होते हैं, लाइक whenever there is any youth competition held, for which every player has to be registered. He has to be registered with the specific federation. Suppose he is playing from as a 100-meter runner or as a long distance runner, so he has to get himself registered with the Athletic Federation of India. Now, whenever competition will happen, there could be two things for the federation to do. One is to register the participating athletes much in advance, and one would be to register the athlete on the spot. So when things are done in a very professional way, when the registration process much in advance, then there is a proper scrutiny of the certificates, and there is a team which is there. We can see all the certificates properly. बट अगर जहाँ पे ऑन द स्पॉट रजिस्ट्रेशन हुआ है, so more often than not, certain certificates would be overlooked, and in such cases, the player who is not the right age may, you know, be able to participate. So ये पहले बहुत होता था competition में. Most of the federations were not very, keeping their eyes open to these type of challenges. But with the coming of the age verification cell and with the coming of the Khelo India competition, these are becoming now a very systematic plan, a very organized plan to cross check the every document which the player is submitting. Now, this age fraud, इसके दो एक बहुत बड़े ड्रॉबैक हैं. एक ड्रॉबैक तो ये है कि वी आर डूइंग इनजस्टिस टू द रूल्स एंड रेगुलेशंस, and we are also doing injustice to the deserving candidate. So it is bound to happen that if you are overage, you will have more of the physical prowess, you will have more of the stamina, you will have more of strength, you will have more of ability to do well. So there is no question for a younger athlete to not outperform these senior athlete. सो इसमें हम क्या करते हैं कि जो हमारे डिजर्विंग बच्चे होते हैं वो रह जाते हैं, और ओल्डर एथलीट होते हैं वो इसमें कंपटीशन में भाग लेके और मेडल भी जीत लेते हैं. और उसमें क्या होता है, इन द लॉन्ग रन यही ओवर एज बच्चे बाद में दे आर नॉट एबल टू परफॉर्म वेल इन दी सीनियर कंपटीशन. सो हमारी कंट्री को एक बहुत बड़ा नुकसान हुआ कि हमने एक बहुत अच्छा टैलेंट, जो यंग टैलेंट जो हमने पिकअप करना था यूथ कंपटीशन से, उसको नहीं लिया, और उसको एक एक्सपोजर नहीं दिया ट्रेनिंग का, कैंप का. और दूसरा, हमने अपने सीनियर कैंप में ओवरेज बच्चों को रख के अपना एक मेडल भी इंटरनेशनल कंपटीशन में खोया. सो इसके बहुत ही ड्रॉबैक्स हैं, और ये एक वार फुटिंग पे हमें करना है कि वी शुड गेट मोर एंड मोर ऑर्गेनाइज्ड टू रिमूव दिस age fraud in sports. Rahul Dravid has rightly said that age fraud leads to an erosion of culture. It leads to a scenario where a lot of talented boys don't get to play when they should usually be actually be playing. तो एज वेरिफिकेशन पहले बीसीसीआई ने शुरू किया. दे हैड अ वेरी स्ट्रिक्ट प्रोटोकॉल ऑफ गेटिंग द राइट एज पीपल फॉर देयर वेरियस अंडर 19 अंडर 17 कंपटीशन. फिर उसके बाद फुटबॉल फेडरेशन ने भी इसको बहुत तरीके से लिया, और अब स्पोर्ट्स अथॉरिटी ऑफ इंडिया इज ऑल्सो टेकन इट सिंस फ्रॉम ईयर 2018. So this Ministry of Youth Affairs and Sports has brought out a regulations, और इसके लिए एक लॉ जारी किया गया है जिसको हम कहते हैं नेशनल कोड अगेंस्ट एज फ्रॉड इन स्पोर्ट्स, NCAAFS. And now it is a regulatory, it is a mandatory for all the federations, for all the associations and all the sports control board who are organizing competitions, especially youth competition, and all those who are providing sponsorship to the young athletes. So this becomes mandatory for all these associations to check the right age of the players, so that overage children are not able to participate in the younger age group competitions. Now, in SAI, we started the age verification program in 2018, and up to now, we have checked nearly 4,000 children. एंड एक अच्छी बात इसमें ये है कि 80% बच्चे हमारे सही हैं, उनकी एज वेज सब सही होती है. यूथ कॉम्पिटिशन, या आप ये सोचें कि जब से गवर्नमेंट ने ये मैंडेटरी कर लिया है, सो ऑल दी ओवरेज children are very cautious. They are not, coming to participate in these younger age competition. जैसे कि ये डोप पे आपने देखा है कि once you are caught with having dope, then you are imposed sanctions. So similarly, the same kind of effect this national codes against age fraud in sports has brought. So 80% बच्चे हमारे ठीक निकल रहे हैं. 20% children I have seen still who are फाउंड टू बी ओवर एज। और इसमें वही वाले बच्चे हैं जैसे कि कॉन्टैक्ट स्पोर्ट्स में मैं ज़्यादा देख रही हूँ, बॉक्सिंग में बहुत मिले, रेसलिंग में बहुत मिले, आर्चरी में बहुत मिले, वॉलीबॉल में बहुत मिले। सो ये बच्चे हैं जहाँ पे फेडरेशन हैज़ टू प्ले अ वेरी प्रोएक्टिव रोल इन डूइंग द एज वेरिफिकेशन प्रोग्राम। नाउ हाउ वी आर डूइंग इट हियर, इसमें अगेन हमारा फिजियोथेरेपिस्ट प्लेज अ वेरी इंपॉर्टेंट रोल हियर। मैं देख रही हूँ कि हमारे दिल्ली से और अदर रीजनल सेंटर्स से जो हमारे फिजियोथेरेपिस्ट हैं, जहाँ पे भी कंपटीशन होते हैं वहाँ पे डायग्नोस्टिक लैब के साथ अपना टाई अप करते हैं। देन दे गेट देयर एक्सरे डन, and there is a proper protocol of x-ray, especially for the hand and the wrist. We are using TW3 method for finding the skeletal age of the individual, and in some cases we are using other protocols also. ग्रोलेज पाइले मेथड भी हम यूज़ कर रहे हैं, और इसमें राइट गुड क्वालिटी एक्सरे हैज़ टू बी डन, and then these x-rays are sent to our age verification experts. We have empaneled quite a few doctors, radiologists especially, who have taken special training in finding out the skeletal age or bone age, and then they are able to tell us whether the child is of the right age or there is some misrepresentation of the age. तो यहाँ पे हमारा फिजियोथेरेपिस्ट एक बहुत इंपॉर्टेंट रोल ले रहा है कि वो एक ये भी देख रहा है कि एक्सरे गुड क्वालिटी एक्सरे आ रहा है, क्योंकि डिजिटल एक्सरे के लिए हम एम्फसाइज कर रहे हैं, सो दैट दीज डिजिटल एक्सरेज कैन बी सेंड through online mode to our experts. So all this is very confidential. The player wouldn't get to know who's checking, who's examining his x-ray. And another kind of fraud I've seen while doing the bonage is that player are so smart here that in the documents, because we are filling up the questionnaire and the document also where he gives his personal history. So in the personal history, he will fill up his date of birth, which he says should be there. And in the X-ray, when he goes inside the chamber to give his X-ray, he will say age, which is his right age, मे बी समटाइम्स ओवर एज। तो क्या होता है जब रेडियोलॉजिस्ट के पास ये एक्सरे आता है, वो तो अपनी एज जो उसके फिल्म के ऊपर लिखी होती है उसी से ही असेस करता है और वो कह देता है कि ये बोन एज इसकी सही है। सो इस तरह का भी फ्रॉड हमने पकड़ा है। तो हमने इसमें कोशिश ये करी है कि जब भी एक्सरे फिल्म हो उसमें बच्चे का डेट ऑफ बर्थ, उसकी फ़ोटो और ये सब रहे। इसमें हमारे अगेन फिजियोथेरेपिस्ट का बहुत इंपॉर्टेंट रोल रहता है टू सी द प्रॉपर प्रोटोकॉल, इज देयर एक्सरे की क्वालिटी अच्छी आ रही है। समटाइम ही हैज़ टू ट्रेन दी रेडियोग्राफर देयर कि मुझे इस तरह का एक्सरे चाहिए होगा फॉर मोर ऑफ माई एथलीट्स देयर। सो इन द फील्ड सिचुएशंस इट बिकम्स वेरी क्रिटिकल। फिजियोथेरेपिस्ट हमारे गेम कंपटीशन की साइड पे रहता है, वहाँ से वो फिर बच्चों को डायग्नोस्टिक सेंटर्स पे ले जाके फिर वहाँ पे उनके एक्सरे के लिए भी लाइन अप करता है। So this how it helps in finding out the age verification. So this is the typical X-ray which we get for finding the bone age. As I said, in some cases we are also using GP method. And then it was the first news item which came in the released by Star Sports in Times of India, wherein they said that government is now very, very strict on the age verification test. Now, another challenging role which most of the physiotherapists here I've seen do not especially like it, and in some cases, some physiotherapists, of course, do like it, is in the procurement of the physiotherapy equipment. Now, क्योंकि हमारे सेंटर्स बढ़ रहे हैं, नाउ वी आर गोइंग अप टू द हाई परफॉर्मेंस सेंटर एट एवरी state, unlike earlier times where we had 7 main regional centers. Now more and more we are making our footprints into different states, into high performance centers where all the state of the art facilities are available. So first beginning is from the physiotherapy center, which is the first line of treatment for the player whenever injuries will happen or wherever we want to prevent injuries. So इसके लिए हमें क्वालिटी इक्विपमेंट चाहिए। तो इसमें हमारा फिजियोथेरेपिस्ट इन्वॉल्व हो जाता है विद इक्विपमेंट डिवीजन टू गिव गाइडेंस टू दी जो दी एडमिनिस्ट्रेटर्स की कौन सा इक्विपमेंट अच्छा रहेगा. सो इसके लिए वो डॉक्यूमेंट्स बनाता है, एक एक्सप्रेशन ऑफ नोट बनाता है. देन ही हैज़ टू फॉर्मुलेट दी टेक्निकल स्पेसिफिकेशन. जब टेक्निकल स्पेसिफिकेशंस किसी इक्विपमेंट की बनाता है, तो then he has to tie up with various medical hospitals and get in touch with the HODs of the various centers, see whether that equipment is used there, what is the performance of that equipment there, how effective it will be in the sports. So all that, pros and cons he has to see and then make the technical specification of the item. उसके बाद he becomes a member of the technical evaluation committee also. So here whatever the specification that are mentioned in the tender note, he has to compare that and finally select the equipment. So this is a very very challenging, very very tricky job, and tricky in the sense that you have to see that you get a right equipment with good technology and at the competitive rates. So हमारे physiotherapists इसमें भी बहुत involve हो रहे हैं, and I'm sure they will bring good technology to our for use for our players. Now, another thing which we had been, indulging into from the last more than 15, 20 years, I must say, is in the training and recently in the research also. So at Sports Authority of India, we have tie-up for SAI internship program, where our MPT students, they just come for their clinical based training, and some of them are also doing their dissertation work here. So we have our association with Jamia Millia, Jamia Islamia, Amity University, Manav Rachna, and Delhi University, and also ISIC. And here, the physiotherapist, all the young physiotherapists, I am saying that not only you get associated with the physiotherapy department, the medical department, you also get a hang of the sports science centers. So we have all the experts available in human performance lab, where we have nutritionists, we have psychologists, we have physiologists, we have anthropologists. So whatever your choice of research, whether you want to work physio with nutrition or you want to work physiology and physiotherapy, so there is a lot of opportunities for you all to get associated with the expert and with the lab. And I'm sure with these type of training and research, more or more good findings will come from this research, and more good inputs will be able to give to our athletes. Because मैंने देखा है कि हमारे इंडिया में जो रिसर्च है अभी भी सिंपली कॉपी पेस्ट चल रही है, कि हम देख लेते हैं जर्नल्स में से, ओ हो ये वाली स्टडी है, मैं अपने फुटबॉल के ऊपर ये वाली रिसर्च कर सकता हूँ, या मैं अपने एथलीट के ऊपर ये कर सकती हूँ, बट वी आर नॉट यूजिंग आवर wisdom in what the player wants, what the coach wants, what the support staff wants. Okay, the need of a player and the coach is different in different in scenario in different countries. For example, nutrition, what the nutrition will be in India will be very much different from the nutrition inputs of a foreign country. So हमें बहुत ही इंडियनाइज्ड रिसर्च करनी चाहिए, or we have to get ourselves totally involved in the training and the with the coach. और हमें उनसे पूछना है कि आपको क्या चाहिए, किस तरह के आप प्रिवेंशन दे सकते हैं. उनका आप ट्रेनिंग सेशन देखेंगे तो आपको कई चीज़ें अपने आप से ऑब्जर्व करेंगे कि हाँ, इस समय मैं इनकी हेल्प कर सकता हूँ, और हेल्प कर सकते हैं तो कौन सी मेथडोलॉजी आपके लिए बेस्ट करेगी. तो उसके लिए हमको एक स्मॉल रिसर्च ले सकते हैं. वी हैव गुड डॉक्टर्स टाई अप. So I will encourage more and more of the young people to pick up very apt and very useful research studies here. हमारे कुछ जो रिसर्च चल रही है उसके टाइटल आप स्क्रीन पे देख सकते हैं. Some of them have been able to publish in international journals also. So this is just 2 3 which I have put it. every year at least 5 or 6 research are happening from the physiotherapy department and also from the physiology department. So I want more of you to get into other departments like nutrition or psychology, and get motivated to do good quality research. Now, recently, another challenging job for a physiotherapist was also a COVID-19 situation. Here, I wonder if physiotherapists, I must be listening to me, they must be really cursing me. Here, our administration got a physiotherapist involved for all types of COVID, precautions, because not only was the training suspended, but whatever athlete were held up in our centers, we had to give them the best treatment and best caution so that they don't get infected with the COVID. And here, our physiotherapists did a very great job. They, starting from the first test, when the test was costing something like, 4,000, 4,500 to now as low as 800. So they had a very challenging job to, bring on board different diagnostic center and get the COVID testing done for our athletes at the shortest period of time. So here our physiotherapists are also giving counseling sessions. They are helping our athletes one to one on Zoom and on WhatsApp video, what precaution he should take if he has had a COVID, or if he has come in touch with a COVID patient, and how he has to prevent himself. So this is all about scenario at Sports Authority of India. I'm sure you may have liked it. This is just a glimpse I wanted to show, like what all physiotherapist is doing in the sports scenario. And before I close my webinar, I just want to have you all a small laugh also, because what are the challenges of online education? Please have a look of this also.
Ma'am,
Thank you.
ma'am, excuse me, ma'am.
Yeah, please.
Ma'am, can you please show the slide number 33 once again?
Okay.
Thank you, ma'am.
या सो ऑनलाइन एजुकेशन के कुछ फ़ायदे भी हैं, कुछ नुकसान भी हैं, एंड स्पेशली इन फिजियोथेरेपी आई एम श्योर वन टू वन training. I'm just wishing that COVID gets over fast and you get back to your institution mode as the
चुप
earliest.
रहना।
Thank you.
Thank you, ma'am, for a lovely session. Even despite of your busy schedule, you have come here and oblige us with this kind of information. Like even I had spent my 6 years in sport physiotherapy. So many information what you shared till now. So many things even I don't know. I'm very thankful to you that you are here. Uh, and it is our pleasure that every single time whenever we approach you, you always ready for us, and I'm very thankful to you.
Thank you.
I'm very thankful to our I'm very thankful to my officiating in charge, Dr. Nidhi Kalra, who provide us and give this boom for that we can do such kind of a webinar for continuous learning, and we can connect all over India. Right, we are sitting here and we can connect all over India physiotherapists and share our knowledge. I'm very thankful to our organizing team, that is sports club. In a sports club we have 6 students, They are did very well, very hard working. They are did very well, organized job to organizing this webinar, and I'm very thankful to all the participants who are here, and we are
Right.
seeing. And I'm very thankful to all the participants who are patients listening and make this webinar very successful. And ma'am, we are looking forward to your support as well in future, that you share
Okay.
on your knowledge.
Sure.
I'm See, I'm very thankful to all of you. Thank you, ma'am. And for the more knowledge and for more study material, kindly subscribe our YouTube channel. Ma'am, as आप भी join करें हमारा YouTube channel, that we are going through so many webinars on these kind of informative session. Thank you,
Right.
guys. Thank you so much, ma'am. Thank you
Thank
so much,
you.
आप. Thank you, guys.
Thank you. Are there any questions?
Yes, ma'am. Ma'am, we have a few questions from our student side.
Yeah.
The first question is like from the female physiotherapist. Is she is asking that for the female physiotherapist, she has to join master in physiotherapy in sports. So she's asking, there is a career opportunity in sports for the female physio.
Yes, there are a lot of opportunities for female physiotherapists. As you know, in most of the women players, we our choice is first female physiotherapist. And also, whenever the team goes outside India, our first choice is a female physiotherapist come manager. So there are good opportunities, and there's equal opportunities for male and female. So I don't think she should worry whether there are much opportunities for female or not. It's equal opportunities.
Thank you, ma'am, for a clear our doubt. Ma'am,
Yeah.
our next question is that in your slides, in your talk, you had shared that you are going through like shockwave therapy for the trigger point release.
Yeah.
So one of the therapists is asking what is your experience? What were your experience when you take that session?
Oh yeah, that's a wonderful questions, because to tell you that I had a, cervical spondylosis for a long time. And since I was doing some kind of physical activity which was biomechanically incorrect, so I used to get lot of trigger points. So I was showing this to physiotherapist and he used to do manually, release my trigger points. And to tell you very honestly, I was very wary of the laser and also of the shock wave. So, our senior physiotherapist in Sai once told me कि you don't have to worry, you at least take one session. So before that, I just tell you the background, like shockwave therapy also came with lot of wisdom and crisscross, because whether we should go for pneumatic or whether we should go for electromagnetic. So anyway, whatever the result, as I told you, ki physiotherapist involvement in procurement of equipment also. So since I was chairman of that committee, so finally with great efforts we got shockwave therapy. अब खुद लेके मैं ही घबराऊं कि मैं शॉकवेव थेरेपी ट्रीटमेंट ना लूं, दैट वाज नॉट करेक्ट. सो टू माय सरप्राइज, जो चीज़ मुझे 2 साल से तकलीफ दे रही थी, in 2 sessions, and touch wood till date I don't have any problem. I'm able to do every activity I was doing earlier, and the pain just vanished. So this shockwave therapy is becoming very popular with our athletes, and they just come for 1 or 2 sessions and then they never turn back. So I'm getting patients from Safdarjung Injury Center also here in Sai. Those who are not able to get treatment there with other electrotherapy modules, so they come here for shockwave. So good. So I think some physiotherapists should do more research on this. Ki in what kind of problem this is instant, you know, therapy to give relief to a player. Yeah. Is it okay? Am I able to answer your question?
Yes, ma'am. It's very clear. You clear our doubt with your experience as well. So we have with us Miss Zainab. So she had a few more questions, one or two questions she want to ask you. Please, Zainab, you may ask.
Yes, sir. Ma'am, would you encourage women physiotherapists to do their masters in sports PT?
Why not? As I told you just now, as I told you just now, there's equal opportunities as a physiotherapist in sports. The female physiotherapist can work in close contact with the all female athletes. The choice for a athlete, especially for a woman athlete, will be a woman physiotherapist first. And the role of physiotherapist is everything. They not only become the therapist, they are the friend, philosopher, and guide. And if you are not able to share your problems as openly to the therapist, then what's the use? So I'm sure female physiotherapist is a great demand. It is. Okay.
Thank you, ma'am.
Hmm.
Ma'am, next question. How do you decide which athletes are most suitable to a particular sport?
Oh, that's a very long question. That is what we do is talent scouting in a Sports Authority of India. Okay, so we have some protocol wherein we have some benchmark in case you are looking for a volleyball player or a basketball player, these are the qualities which is required as a young athlete. You must have height, you must have agility, you must have explosive power. So all these we have, norms, and we do physical test in the field, and based on their performance in the physical test, we say, okay, you could be good in this game or that game. So this is a complete talent scouting program. I mean, it is a very scientific program. It is not so easy. It is a very complex thing. Yeah. So once you get associated with sports, you will understand more how coaches, the scientists, the physiologist, the physiotherapist help in finding the right talent for the right age. Yeah. Yeah.
Thank you, ma'am.
Yeah. Thank you.
It was such an honor for having you, ma'am, with us.
Thank you. It was my pleasure to address you all, young physios, and all the best to you all. And if you have a passion for sports, if you have a passion for treating injured people, follow it with your best intention and with your best expertise. Okay, because you're dealing with athlete, the better treatment you good give, the faster you make him get back to the field, the most honor and respect you will get in return. So, all my best wishes to all the young physios who are listening to me. Please take your training, take your education, and take your, all type of manual therapy very, very seriously and very, very carefully. Thank you all.
Thank you, ma'am. Thank you so much.
Thank you.
Thank you,
Thank
everyone.
you.
Thank you, Zainab. Thank you, Sports Club. Thank you, everyone.
So I close down now.